Hello, nurse clinicians. My name is Mark. I'm just starting off this channel, but my topic today is the 5 things I wish I would have known before I went to nursing school. And number one is that, the professors are human. They all have problems. They have bad days just like all of us. So we have to, treat them that way and sometimes give and take. And, sometimes when they're being more difficult, maybe they just, had an issue or something going on. But at the end of the day, we have to remember that they're trying to help us and trying to teach us something. And, just kind of roll with it and don't take everything they say and do to heart. And if they do have some criticism for you, just go with it and try to learn and just try to understand that they're trying to help you. And the next one is, a lot of people in my nursing school class, they studied a lot in groups, which is good. If that works for you, that's a good style because you can ask questions and you can kind of feed off of each other and bounce back. But that's not for everybody. If you study better by yourself, if everybody's always pushing for for group studies, I think in nursing school they push that a lot, for the interaction and just some of the styles is improved, like learning within a group setting. But it's not for everybody, and if it doesn't work for you, you need to find your own and basically find your own way to study and to succeed in all your classes. And number three is, going to class makes a big difference. Obviously, a lot of nursing schools um, have an attendance policy, so that's already kind of built into the curriculum. But the main thing is, going to class, interacting with your professor and asking questions. And if you don't understand something, you need to speak up and go ahead and just try to get that explained and solidify that knowledge, because if you don't understand one concept, other concepts build on top of that. So that's the main thing. Um, Number four is, in nursing school, you get what you put in. There's some people that, can learn very easily and do well without studying much, which is fine. That's great. But for most people, you have to put in the work, you have to put in the effort, to do well and make good grades and, learn the concepts that are going to basically define the nursing care that you will provide in the future. And, some of the stuff, yeah, it doesn't really make sense, but ultimately you have to understand the basic foundations of disease processes, medications, and all the different things that we have to do as nurses, skills and everything. So you get what you put in. Okay. And then the last thing is that just because you make straight A's, you do great, you can do all the skills in skills lab and everything, doesn't isn't mean that you're gonna be a good nurse. That those things, the skills, the didactic information, that's good to make straight A's. Of course, you should always try, but application in the real world matters as well. If you know all the knowledge but you can't interact with a patient, you can't make them feel comfortable while you're doing something, then you're it's not that you failed as a nurse, but that's something you can improve on. So making straight A's is not going to define you in nursing school when you become a nurse. Just focus on doing well, taking care of patients, and learning the information, but then also applying it, to the real world. So, all right, thank you, and hope you enjoy the video.